Welcome to the Voices of Valor podcast, where we honor pioneering women who are redefining business and leadership across various sectors in the region. I'm Nada Khaddash Subah, the director of the Center for Women in Business at the Sulaiman Alayan School of Business at the American University of Beirut. We launched this podcast against the backdrop of one of Lebanon's most challenging humanitarian crises in decades. Yet, in the face of adversity, we are inspired by the remarkable stories of women who are driving change, uplifting their communities, and leaving a lasting impact. It's with great pleasure that I introduce today's guest, Professor Ghina Ghazeeri, a visionary in her field and an advocate for the transformative change. Dr. Ghazeeri is a professor of obstetrics and gynecology who has been practicing at the American University of Beirut Medical Center since 2004, where she earned her medical degree and completed her residency as well. Dr. Ghazeeri pursued a fellowship in reproductive endocrinology and assisted reproductive technology at the University of Tennessee and obtained a diploma in clinical embryology from the University of Leeds in 2008. Since 2000, she has published over 50 scientific papers in peer-reviewed journals. She is an active member of numerous scientific and medical societies, including the American College of Obstetrics and Gynecology and the American Society of Reproductive Medicine. Dr. Ghazeeri has held several leadership positions, including serving as the director of the Reproductive Endocrinology and Infertility REI Fellowship Program and the Fertility Preservation Program at AUBMC since 2020. In 2023, she was appointed head of the division of the REI and the director of Haifa-Dries Assisted Reproductive Technology ART Laboratory. Beyond her medical career, Dr. Ghazeeri is a committed community leader, dedicated to supporting disadvantaged populations. She founded the Hope Fund, which provides financial assistance to low-income individuals and cancer patients in need of IVF and fertility preservation. Recently, she has focused on providing displaced Lebanese women with access to health care, leading multiple volunteer initiatives to deliver essential treatment and care to the underserved communities. We are delighted to learn from the experiences of today's Voice of Valor, Professor Ghazeeri. You're most welcome.
Thank you.
Dr. Ghina, as a leader in your field, what are some key milestones in your career that have shaped your role as a leader in the women's advocacy and a trusted voice for raising awareness among or about women's health?
Actually, you don't know that you can lead unless you are put in a crisis. And I think it was in 2019 when Lebanon passed through the economic crisis, where we woke up one day and we discovered that our IVF unit, the REI unit, might be closing because we cannot afford to get the medical supplies that you have to pay for in dollars. Your patients cannot afford to go through an IVF cycle because they cannot afford it, since they don't have the fresh cash that they can use to support their medications. Many of the medications were not found in the market because these medications cannot be brought from abroad because of the financial crisis. And definitely, we found that we are in real crisis. This was between 2019 and October 2020.
Yeah, due to the devaluation of the currency.
Definitely, 100%. So this is when I stepped in, and the first thing that I had to do was definitely taking care of the people around you. This is the first thing. And I think this was the definition of leadership, how to take good care of people around you. Because it's not only your patients who were suffering, it is your staff who were suffering. And it was this uncertainty, what's next? What would happen to our unit? And honestly, I worked at different levels. Other than taking care of my staff, the nurses, as well as the embryologists, who also had their own financial issues. Taking care of their mental well-being was my priority. And then I worked on the finances of the REI unit, where I worked on lowering the overheads and improving the services. And one of the most challenging was how to help patients and not to stop the cycles that were taking on in the unit. And actually, you would be amazed how patients were ready to help each other. I mean, every patient who got pregnant, I came and I offered her if she can help sponsor another patient. And many patients were ready to help other patients fulfill their dreams and achieving the dream of motherhood. And I would say more than 50 patients were able to support other people, and this means that we were able to support more than 100 cycles, patients supporting each other. And this is how the idea of the Hope Fund came into light. I was able to establish this fund by the donation from generous patients. The beginning, this fund was supposed to help patients undergoing fertility preservation because they had cancer, and we needed to take care of their fertility before they undergo chemotherapeutic medications that will affect their potential to get pregnant. And generous donors as well as other sick patients were able to support, and this is how it started going, and still it's supporting patients over the past 5 years, since 2019.
That's so nice. So from patients to patients.
Definitely. Now, as far as the medications, because they were not available in Lebanon, I contacted some pharmacies outside Lebanon, and they were ready to help these patients. And this is how I was able to get the medications to the patients undergoing the treatment. I mean, definitely they will be paying for them, but at least they were available for them to undergo their IVF cycles without interruption.
That's so inspiring. Actually, Professor, you hold many titles, like the medical doctor, the professor, the head of a unit, the inspirational figure, the mother, the wife, and we can just have some more. In a society that can often be challenging for women like you, like us, what has driven you to pursue further achievements and continue excelling in your career?
Patient help and women help, women support. I think it was the major drive for me to achieve. If you ask me what's the first leadership role that you took in your life, I would say it was motherhood. And raising 3 children, each one with his own temperament, is not an easy task. And being a physician at the same time is also not an easy task. Managing clinic and patients, mainly women, is not an easy task. Being a surgeon, a leader in your career is not an easy task. But I think it all goes to the drive, is putting women's health as the first, as your main passion. And I think this is how you can reach your goals. Just fulfilling your passion by helping other women, whether with safe delivery, healthier life, or achieving their dream of getting pregnant and having a child.
What differences have you observed in how the medical field in Lebanon, the region, addresses the needs of women compared to the needs of men?
This is a difficult question, although I think the answer is very clear. Social support. Unfortunately, we as women, we grow up just with the dream of having a family. And also we grow with the dream of fulfilling your passion about having a successful career. And you want to reach this balance where you don't want to compromise your family welfare as compared to your patient's welfare. And you also don't want to compromise the patient's welfare when you are fulfilling your the motherhood and your duties as a mother. And this is where the choice becomes very difficult, although it should not be a choice. If you have the proper social support, the proper social environment around you, and if you play it in a smart way where you can delegate things, I think you can achieve both. I'm sure you can achieve both. But definitely, you need the social support around you, and you need this dedication where you believe in yourself. Yes, I can achieve it. Yes, I can reach what I need to reach without compromise. And you have to be assertive about many things in your life, and don't allow anybody to make you believe that you cannot achieve it. Yes, you can achieve it.
Yeah. So the typical challenges of the issues that women face in their medical career, also as well, do you just like say that it's the social support or the social, what are some major issues that females would face in their medical journey, and how do you think they can encounter such
It is
issues?
the society.
It's the society.
Okay, it's the society. Let me give you an example. I'm going to start with a story. I was a resident in the OBGYN department, and I was a chief resident, which means that I finished 4 years of medical school, then another 4 years of OBGYN residency. And once I had the patient in labor where we took a decision to get her down to a C-section. And then her in-law came to me, she said, "Oh, Dr. Ghazeeri, who's going to do the surgery for her?" I told her, "Well, I am who's going to do the surgery." She looked at me and she said, "You are the surgeon?" I was an MD and I was finishing my residency. I said, "Yes, I'm going to do the surgery for her." And she was upset because she thought that only surgery is the specialty, it's a male specialty, and you cannot do the surgery for her. And she was skeptical, she was hesitant about shall I feel safe? Is her daughter-in-law is going to be safe? But then definitely I did the surgery. It was very smooth, it was very easy. And I think the problem is that we are still struggling to build the trust in our community about having a female surgeon fulfilling the surgery or doing the surgery. It needs some time, but I think with us being assertive and being very knowledgeable, I think we will build the trust in our community. So I think the first opposing factor for you will be the community around you. Are you sure you can do it? Yes, I can do it, and you have to be assertive about it.
Yeah, actually, I second your opinion. We had recently, hopefully, we will have the article published that, yeah, females in health sector or physicians in health sector would face most of the time the community's perspective towards their work,
Definitely.
feeling that there some domains are male domains, others are females, which was one of the most important findings in our research. Among your many accomplishments as a medical professional and women's advocates breaking barriers, the Dean's Award for Clinical Excellence, which you were recently awarded, and this stands out. After 20 years of service in the field, what advice you give to young women, young females who are starting their medical journey or they are starting their journey in the medical profession and striving for excellence just like what you did?
I think the definition of excellence in healthcare is empathy. The more empathetic you are, the more successful you'll be. And it's something that you cannot pretend. It's something that you cannot acquire. You can train yourself to be more empathetic, but if you ask me what is the reason for your success, it is empathy. I feel with every single patient I am attending to, whether she's a gynecology patient or obstetrical patient, old patient, young patient, I feel with them all the time. And I think this is the reason behind my success, if you want to call it as, the success for behind the Dean's Award. I will never say no to any patient. No matter how busy I am, I answer most of my patients as much as I can, as much as my capacity help. And honestly, I am able to build many small teams around me that can help support these patients if I'm not available to be a good listener for them at the moment. And I think this is the reason for success. Building successful stories everywhere around you, whether in my clinic, whether in the IVF unit, whether in my community. I think it is a message that I leave to every single woman resident. It is empathy and help people around you grow. And I think this is the reason, this is the recipe for success.
Yeah, and for leadership. Leaders
Definitely.
grow leaders around them. Yeah, of course. How is women's health specifically impacted during times of war? And this is what you witnessed lately in the last war we lived. And what mitigation efforts can be implemented to really address these challenges?
Okay. I believe the war that we passed through in 2006 taught us some lessons. And this is when we stepped up immediately once the crisis started in Lebanon, once the war started in Lebanon this September. And we knew that women's health is going to suffer most because I don't know, in 2006, we didn't have the knowledge about how to help, but I believe with the knowledge that you had, for what I had from 2006, I knew that women in the displaced shelters need most support, whether with gynecological care or with obstetrical care. And we started immediately getting the data about how many women are displaced, or pregnant women are displaced. And this is when we came with the idea of opening the clinics on Saturdays for women who are pregnant and they don't have access to obstetrical care. And actually the first day one of my fellows went to the displaced areas. She bought the Doppler from her own money. And she went there just to help women getting reassured that their babies are fine and listening to the baby's heart. And I feel so proud of her because it was a personal initiative to go there and help the pregnant women. And then we started our weekly clinic with a hotline. Patients used to take appointments just over the phone. And we used to see around 25 women per session. We saw up till now around between 70 to 100 patients since the beginning of the war. One of the most frustrating things that I saw in my clinic is the approach towards the mental health in these patients. And unfortunately, this is going to be our next pandemic. The mental health crisis is going to be the second thing that we'll see in Lebanon. Because it is not only about the financial issues, it is about this threat, continuous threat that I might be losing my pregnancy, or I might be losing my life, or I might be losing people who I love around me. So the mental health issues were the just top on the list for the patients who were displaced. Add to that, many of these patients, they came from areas which are far away, which are not their usual environment, whether they were displaced in schools or even living in places where are not their actual homes. They were worried about the new physician. They don't know the new physician that they are going to see. They were worried about their health, what will happen, if they can reach the hospital or not. Many of these patients were forced to live in areas close to the hospital so that they will reach the hospital in a very short period of time. Now, we found also, I saw some medical issues in these patients other than anxiety and depression. Some of them lost their pregnancy, high risk of miscarriages. And I was telling some media today that we saw patients who lost their pregnancies just because of abruption, because of the sound, the high sound that they were exposed to. This was the story that I posted on my Instagram. It was one of my patients who lost her house. She lost the baby's clothes, and 2 to 3 days later she came with bleeding. I believe it's because of high blood pressure or anxiety that she passed through. She had bleeding inside her womb, and this is when it was so critical for us to do an emergency C-section for her to save her pregnancy, to save the baby. Alhamdulillah, luckily the baby survived. But one of my patients, the baby didn't survive. She lost her pregnancy at 9 months of pregnancy. And I don't know, maybe because of anxiety or depression that she was passing through with all what we were passing through with the high sounds or the bombs around us.
Yeah, everyone can witness just like some cases that women faced, and especially in addition to that, the healthcare issues, and also the needs that women really needed in their shelters or in their displaced areas. Yeah.
You know, it's not only taking care of the patients around you. I think it had also to be it's taking care of the staff around you. It's not easy to put a smile on your face every morning when you might be on your WhatsApp all the night, where you were worried about people that you love who are being displaced or they are not around, or you're worried about what's going to happen the next morning.
Or even seeing this number of patients, it's just
course.
like because you're in direct touch with people who are directly affected in what's
Some
going on.
of my patients, they lost their relatives, they lost their brothers, and other than losing their homes, it's not easy to put the smile on your face and come every day in the morning, and just is going to be another day, and you don't know what's going to happen this night, or the next day in the morning. Even many of my staff, they lost their homes, and they were displaced themselves. So you had to take care of your staff as well as of your patients, and taking care of your own mental well-being at this time. And it's easy to talk about it now that we are beyond what happened. But I don't think we should forget, and we should always be preparing ourselves for crises in Lebanon.
Yeah, unfortunately.
So unfortunately.
And this is what we expect. We expect always our medical doctors to be smiling, as if we see you as always smiling faces, as always people who are going just like to heal what we're passing and to give hope.
Definitely.
And we forget at some point that this is the human nature at the end. You are affected just like as we were at that point, and especially being you as the medical doctor in this sector in specific, where you give hope, you just like have new lives coming, new patients or fertility rates and all of this, and you're working on that, and then you pay an outsider that affected all your.
That's true. I think I need to comment on the psychological turmoil that I passed through when I was leaving home and running to deliver this patient at 3 a.m. in the morning. Because I imagined her, she lost her house, she lost the baby's clothes, and I was all the time praying, saying, oh my God, please, I don't want her to lose her baby, come on, too, at the same time. I mean, this is something traumatizing for her and for me.
Yeah.
So it was so challenging for me to reach her on time within maybe like 5 or 6 minutes. And I was with my residents over the phone preparing her for C-section. Luckily, she was fine and her baby was fine. But I think I'm happy that we had a happy ending.
Yeah.
But this is not easy for us too. It's not only for the patients.
Yeah, and it's not always a happy ending. And on the other hand, just like
it is traumatizing for everyone.
Go back to the empathy that you mentioned in the beginning of our episode. Like, yeah, due to being empathetic, you were just like disconnected with your patients, which is a must for us as patients, just like to see our medical doctors really caring for our well-being and our health and all these stuff. Actually, maybe you talked about an impressing story or impression that the last war left for us. But in case you had any most recent story that happened in this war, just like to share with us. And how did your education and background at AUB help you to simply or help elevate this situation or your leadership career into this stage?
I believe the most important, I think my most important mission, as I said earlier, it is supporting women's health and women's education. I believe I need to be prepared for the next pandemic, which is the mental health pandemic. I think we need to concentrate on the mental health of us, of the staff around us, as well as our patients' mental health and mental well-being. And this will be our next mission, in order to be able to build a country around us. We have to be both mentally prepared, physically prepared, and I think this will be our next mission, taking care of people around us, whether through education or through improving their mental well-being. And I believe this is the only way to build the community around you.
A healthy community, yeah. During the war, you said mainly, you said what did you observe of the challenges or the changes in the patients during war or the patient lives, and you mainly stressed on their mental health, definitely in addition to their physical health that you mentioned. But how did the conflict shape the struggles faced by women throughout this period? So were it accessible to all or to most of women patients to access the support they needed, or did you believe that there are some women who couldn't achieve the support or they were affected more than others in this last war?
I have no doubt that not all women were able to achieve the psychological support that they needed. I have no doubt. But I'm also happy to know when, to learn from my patients when they say, when we reach this clinic or we reach this center, we feel so reassured that we will be taken very good care of. And I think this is the message that we needed to leave with our patients. The mental problem, the mental turmoil that we passed through was not only, I cannot only apply it only on women. I can apply it on the whole family. I even had husbands suffering at the same time with their wives, because they are responsible for the household, for the well-being of the household. And I believe I was a very good listener at the same time. Just listening to them and trying to soothe them and ease them alone will maybe remove like 20 to 30% of the psychological impact of the war that they had on them. And to be able to assess the severity of the situation and refer the patients when they needed referral, this is extremely important. Okay? So definitely being a shoulder to cry on maybe is something very important, but also being able to recognize those who need more medical help than others is also important.
Doctor, you're talking about your patients. What about your team? I know your team needed this support as well, or to a certain extent, and they are residents as well sometimes. How did you manage properly your team, your staff, the department as a leader during this time, as well as on all times, specifically during the time of war, crisis, which we've been witnessing. Which we've been witnessing since 2018, when the currency devaluated, the poor explosion, and then our last war?
Excellent question. As far as my staff are concerned, keeping them busy all the time. I kept them busy all the time. We came up with the digitalization of our IVF unit. It's digitalized right now. Some research projects for the staff, quality improvement projects, inventory. They never had any single day without something to do. And I think this impacted our IVF unit once the war was over, or even when the economic crisis improved and the economic situation became a little bit better. As far as my residents, I was challenging them all the time. Lectures, teaching, research. I don't think they had any single day without something to do in their hands. And I think this is one of the leadership maybe skills, just to keep people busy around you. So this is a way for them to forget what's going on around them. So by 5 or 6 o'clock, everybody achieved something during the day.
Can you brief us a little bit about the success of the IVF unit at UBMC when you just had the leadership position in that department?
Unfortunately, we had some financial issues before 2019. And when I became a bit more focused on the finances of the unit, categorizing them, lowering the overheads without compromising the quality, and getting the best out of my nurses as well as my embryologists, we were able to turn a unit which was losing financially into a unit which was gaining financially with a significant surplus. This surplus will be used to advance the patient care, buying more instruments, and definitely to improve the patient outcome. So we were able over 3 years, instead of being in a negative financial state, now we turned to being into a positive financial state with a good surplus. And I'm so proud of that.
Yeah, we are proud as well, actually. It's highly needed. Thank you, Doctor, for being our guest for today. It's really inspiring. We always just like see you as a role model in the medical healthcare sector. Looking forward to more successes and to more achievements. Until next episode, thank you.
Thank you so much.
Thank you for joining us on today's episode of Voices of Valor. We have heard incredible insights from Professor Ghina Ghazeeri, and we hope her story inspires you as much as it has inspired us. The women we feature on this podcast embody courage, resilience, and leadership qualities that are shaping the future of business and beyond. As we continue to amplify their voices, we hope you are reminded of the power of determination, collaboration, and positive change. Stay tuned for more inspiring conversation with the women who are making a difference. Until next time, keep embracing your own voice of valor.